Hi, I'm Stephen James of One Way Jesus Ministry. I'm a missionary with my family. We've been doing missions for 10 years and we've had to have a steep learning curve. We're British missionaries, which means that regarding our teeth, we were relying on the NHS to take care of our teeth. As we travelled, we realised that free dental treatment isn't available in every country and that we were hitting problems. And so I started my journey 10 years ago of improving our dental care. And one of the first things I did was swap to a sonic toothbrush in 2010. It was a Philips sonic toothbrush, and the only problem we found is that it wasn't terribly reliable. In other respects, it was really, really good. We found that we were drinking too many sugary drinks when we came to Jamaica in 2010, and within less than a month, my wife lost one of her teeth because of the amount of sugar and decay that was going on very, very quickly there. So we soon really learned that we've got to change the way we care for our teeth, change the way we eat. And it's been a slow process. It's taken us 10 years to get to where we are. So I want to give you some shortcuts now. The first thing I want to say is, if you're using a manual toothbrush, I would strongly recommend you get an electric one. I've seen people use manual toothbrushes for months and the head is frayed and they look a mess and they don't do their job properly. And it's true for electric toothbrushes as well if you don't change the heads, but I can't imagine how useless those heads are. They don't get between your teeth. So it's really, really important that you do use a toothbrush that isn't worn out and damaged. So, and as you get older, you realize the importance of it. So here we are. We've purchased about 4 years ago. These are Colgate sonic toothbrushes, and they're very, very good. I would say that we've dropped them a number of times, which is normally one of the problems with the Philips one. If you drop it, it just packs up, it goes crazy. We've dropped these, we've got young children, and as you may be able to hear, it's still working absolutely fine, so I can recommend it. The only thing is, the batteries do go fairly quickly on these in terms of their lifespan because they're so small, but they have got a guarantee, and Colgate do honour their guarantee and will replace the toothbrush if it's within, I think, 3 years. The thing I would like to say that's good about the sonic ones as compared to a regular mechanical one, excuse the noise, I'll wait till the car passes. Right. So the good thing is that these are very good for doing the high part near your gum line around here, and if they go on your gums, it's actually good because it massages your gums. Now that's not necessarily true for a toothbrush like this, where it relies on a lot of mechanical movement, and going up to your gum could actually erode your gums. It can cause damage to gums over a period of time. So on the other hand, the good thing about these is that they do give a thorough scrub. So these are Oral-B ones, they're German. This is a cross-action head. You do have a choice here of a 3D head, which is not so vigorous, so that's more suitable for going up to the gum line. It's softer. These ones you can really feel they're quite hard. But if you want to give your molars a good scrub, get them nice and clean, I think this is an excellent thing to have. So my recommendation is that you actually own both, and we kind of brush our teeth twice each time. Often we'll use that one and that one, or maybe we'll do it twice with that in the morning and twice with that in the evening, so that we're getting the best of both worlds. So I do recommend you own both of these, not just one of them. Trust me, when you're 57 or older like I am, and you see that your teeth need, care, more dental care, or they get a bit dirtier and yellower and whatever, you want to be as thorough as you can. So this big thing here is actually not that big. You can get bigger ones than these with a tank. This is called an oral irrigator. Now, I highly recommend you get one of these. We first got ours in 2011. It's very, very good. It blasts things between your teeth and up to your gum line as well. So it's very important you do that front and you go to the back and do the back. It really blasts things out. I thought it could replace floss, but guess what? It doesn't. Floss has a place of its own, so I recommend you do oral irrigation. Earlier this year we found out that you should do the oral irrigator first before you brush your teeth, and the reason is that a toothbrush, apparently, sorry about the car noise again, a toothbrush can force the food up into your gum line, it wedges in there and it can cause problems. This one flushes out the loose dirt first, so it's best to always use the oral irrigator first and then use your toothbrush. It's got 3 power settings, a strong one and 2 milder ones. I suspect that the 2 milder ones don't really do that much. It's best to use a strong one. However, children sometimes find it too strong, and if it hits your gum or your tongue, it hurts. Right? So you've got to use it right. But highly recommend you get one of these. Okay. The next thing is flossing. You've got to floss all your teeth really well, and it's very important that you use the right amount of floss and use it correctly. I'm just going to give you a little example here. You should cut off about 1 foot or 30 centimeters. Depends how thick your fingers are. So children can use smaller amounts because they've got smaller fingers. You don't have to wrap it round as much. So you can use it like this. And the thing to do is to go up between your teeth as high as you can. The dentists say that it doesn't matter if your gums bleed, just keep doing it until they stop bleeding. So you just go up between your teeth and push against each tooth. So that's one way that I've been shown. Another dentist said you just push it up there and give it a good turn like that. So it's good to push against each tooth because your toothbrush can't get there. So that you should do all the way right to the back. It's very important, by the way, that you brush your back teeth as thoroughly as you do your front teeth, and it's very important you do the back of your teeth as well, right to the back, because that's where plaque can really build up. Your teeth might look pretty on the front, but they could be yellow at the back. Highly recommend you go to your dentist regularly and you have your teeth checked and cleaned as well. But there is a solution to that as well. But before I show you the plaque cleaning tool that we have, I just want to show you another type of floss. It just comes on a little stick type of thing, and you can get it between your teeth. A lot of my teeth have got narrow gaps, so this doesn't fit everywhere. So I tend not to use it, but my children who've got bigger gaps, they use that. I found, I think it was going back 2 years ago, I was thorough with my teeth, I was doing flossing, and my dentist still told me I had gum disease, and I was horrified. I was shocked. I thought, well, hang on, what more can I do? So she said to me, you need to get an interdental brush. So diligently, we went and bought interdental brush. She recommended TP, which is a European one. I'm sure there's other ones, but TP's European. They come in all different thicknesses, so depending on what you have to get between your teeth. I think the pink one is the thinnest one, and it bends really easily, so it's hard to use, and it bends a lot. The red one is number 2, that's number 1. That still bends, but it's a little bit more rigid. And if you have got big gaps, like I've got a big gap between my tooth here, they do a wide one that's like a little like a little bottle brush nearly. It goes nicely between wide gaps. So highly recommend. I think these are essential that you get things like this. Okay, I would say you should at least have all these in your armory of tools to keep your teeth clean. Before I forget, I noticed that I haven't got my bottle of hydrogen peroxide. Now, hydrogen peroxide, I was told in 2011 that I should rinse with hydrogen peroxide, and I dismissed it. And to my detriment and to my family's, I'm sure, because I thought, why would you rinse with hydrogen peroxide? But when we were in Jamaica, the locals recommended it. Anyway, this year, I've been using hydrogen peroxide, mixing it with 50% water, and this is what we do as a final rinse after we've taken care of our teeth. We've done all the rigorous regime, and we spend on average about 10 minutes each on our teeth, and that's a far cry from the quick 2 minutes you're supposed to give with an electric toothbrush, right? So 10 minutes each time. I recommend you brush your teeth 3 times a day, okay? To keep the acids and so on, the dirt under control. So for me at my age, I find it essential because things lodge in, and if they lodge in, you start getting some decay of the food, and it starts to hurt. So it's really, really essential that you keep on top of it. Take really good care of your teeth. Imagine that you had to pay £500 or dollars each time you had something done to your tooth. I know you don't, but imagine you did. Then you'd have a different attitude towards your teeth. And if you knew that by the time you're 70 or 80 you might lose a lot of your teeth, you'd be pretty sad. So look after your teeth well. So what we do is we dilute the peroxide 50-50 with water and peroxide. You only use a very small amount, like 5 milliliters, and just rinse your mouth out with that as a final thing. Make sure you get it all out because it doesn't taste that nice. Spit it out as much as you can. You get a bit of residue. It does, I believe, and I could see some difference, it makes your teeth look a little bit whiter. Now, my teeth aren't necessarily naturally white. I've got 3 caps at the front, so they look quite white. But they do keep your teeth looking good. The other thing I noticed is if you do get a bit of food which has been trapped and you've got a bit of decay there and the gum is a bit inflamed. When I say decay, I'm not talking about tooth decay, I'm just talking about the food decaying. You've got an inflamed gum, rinse with this, and within hours or overnight you find your gums have settled. I've also been told that a salt water rinse is also good. So you could try that. I tried this year quite extensively a lot of the commercial mouthwashes like the Listerine, the Colgate, and in all honesty, they're probably better than nothing, but they weren't as good as peroxide. So I really, really recommend the peroxide. It actually does accelerate healing, which the commercial mouthwashes don't do. Now, I want to show you a tool here, which we bought, I think, a couple of years ago. It's a plaque removing tool, and it's from Amazon, not very expensive, about £20 or 20 something dollars. It's very, very cheap actually. And all you do is you switch it on, and you can adjust the speed. This one's got 2 speeds, comes with a light that comes on, so you can really see your teeth. And you can't do it yourself, well, you can probably do the outside ones, but it's hard to do your own inside. I recommend if your wife or children or another member of the family can do it for you. Basically all you do is you move it along the surface, try to be systematic, and you'll see, mine are just being done so they're clean, you'll see some like a white blob at the end. That white blob is plaque. Now, before you do this, make sure you brush teeth, otherwise you're going to be spending ages just taking your normal dirt off your teeth, which is a waste of time. So make sure you brush your teeth before you use this, and it makes a difference. You can see the colour of your teeth change. I was getting quite a lot of my teeth done at the back, and my daughter did before and after photos and showed me. I'm not saying they went from yellow to white, because if you see that, then quite honestly, those before and after pictures are not true, okay? But it will go a lighter shade of yellow, because sometimes people's teeth are quite yellow, like ivory coloured. So that's not a big problem. So anyway, that's the plaque remover. Highly recommend it. They usually come with more than one head, so you can swap heads. Unfortunately, we broke ours, so we've got one, so I'm going to have to buy another one soon. Here, this looks like a dentist tray. These are useful to have, because if you have anywhere that, for example, you can't really get to it, this is a very sharp point. If you've got any places you can't get to and you need to just scrape a bit of food out, I don't even know if I'm using it right, but you can scrape a bit of food out or between your teeth. Use it gently, don't chip your teeth, okay? So I recommend you use it on the molars, not between your teeth, because that can damage your teeth. So, but it's not an alternative to a toothpick. Toothpick is made of wood, so please be careful, don't damage your teeth. But certainly when using it on molars, which a lot of mine are filled now, unfortunately, you can use it to get into those little grooves and clean it out before decay sets in. This is a plaque scraper. It's flat, but if you have that, it's more efficient than this. So again, this is another shaped one for picking out dirt. This is a really useful mirror. These normally come with these anyway, or if you buy a set, you'll get one as well. This is so you can see the back of the teeth, see what you're doing. Tongue scraper. I'm not going to demonstrate it, but you just hold it like that and scrape your tongue. Okay. Now, in the event that you're having problems with your teeth, or your gums really, more to the point, this one is called Herbal Dentist Tooth and Gum Oil. It tastes quite strong, but it's very, very effective against diseases. And you're supposed to, it's quite expensive, but you just put it onto your finger and then you rub it into your gums. It doesn't taste nice, okay? But guess what? It does help. And it's got 5-star rating, I believe, on Amazon, or nearly 5-star. It says it helps with gingivitis, gum disease, and oral pain. So if you are having teeth pain and you can't get to a dentist, this is a very good thing to help numb the pain until you can get there. This doesn't cure decay, and it doesn't solve the problem of painful teeth, but at least until you can get to a dentist, it can help, okay? So this is not a replacement for a dentist, but with terms of gum disease and so on, they do say that this helps. And my wife was using it earlier this year when she was having problems with a tooth, and she said it was helping her. That's basically it for now. I can't think of anything else. If you have any further suggestions, I would love to hear back from you regarding any additional tips or modifications to what I've said. Please subscribe to this channel, and if you like it, press the like, thumbs up thing, and do feel free to write comments at the bottom. Thanks for watching. Look after your teeth and they'll look after you. God bless you.